I'm one of the liver consultants here, and with Gideon we run the PSC clinic together, and I've been involved for a little bit of time in I guess trying to develop slightly more modern methods of care that I hope you'll agree are more patient-centred. And I think if you think about how the world has changed over the last 10 to 20 years, how information technology has transformed your life. Hands up everyone who's got a smartphone. Who's not got a smartphone? It's very unusual. They tend to be middle-class bohemians who don't have smartphones. So anyway, so I'll move on to, so what are the problems that you guys have? You've got a rare disease. Yes, you've got a nice shiny specialist centre like this, but it's not necessarily close to where you live. And that then means that there's variation in care. Not down to the fault of doctors. We're lucky we can concentrate on certain things because we have a large service. But if you live somewhere geographically different, your local doctor may not know much about PSC. And then Gideon's talked about all the amazing work he's done bringing clinical trials to the patients here in Birmingham, but again, you might not have access to the trials just because of where you live. So there's the UK, and Birmingham's well placed, it's in the centre, but you can live geographically anywhere, and it can be very difficult and expensive to access the care you need and the trials you need. And in fact, I think we've looked at the referrals to our clinic, and it's amazing how far they come from. And so it is a real problem, geography. And I put these two pictures up because actually the way we deliver care has not changed hugely in the NHS. If you look on the left, that's an outpatient clinic from the ye olden days, and that is now a modern outpatient clinic, and yet things have not changed. The dress and various bits and bobs may have changed, but actually we still say come to clinic, we'll see you in 6 months, we do some blood tests, you probably don't know what the blood tests show, etc., etc. And so our model of care really hasn't changed, but we do need to change that. And I think that information technology now gives us the tools to do that. May not be for everyone, but more and more people are using it to improve things. So, what potential solutions have we tried to do here in Birmingham? Well, I think it started with something called MyHealth, and a number of you may have access to that, and it's really a project we've been running for a little while here. And I guess the idea was that lots of people say, look, I'd like to see my letters, I'd like to see my blood results. We're lucky here, pretty much most of our records and blood results and prescribing is now electronic. And most people put their hand up, have smartphones and have access to the internet and use the internet for lots of services, Amazon, banking, etc. So why not healthcare? We had lots of support, which was important, particularly our chief executive. We initially got charity support, and very importantly, we got 12 patients with liver disease, some with PSC, and they told us what they wanted. And I think that was absolutely crucial. What I've learned working with people in IT for a long time is IT guys are very clever, but you don't want them designing what you want. And it's much more important that the patient says, this is what you want, and then the IT guys do it. And I think that's probably why this has been successful. So we ran this pilot, 12 people. It was successful, so we then approached our board, they funded it, and it went live August 2012. In fact, now we have over 7,000 users over a range of specialties here at the Queen Elizabeth. So a lot of patients who come to this hospital now access this programme. What does it look like for those of you who've never seen it before? You can put your picture where that motorcycle helmet is, and you can keep a diary of how you're feeling. You have all sorts of things on your home page. You can see all your appointments. You can put in data as well as us putting all the data we have. You can look at your medications. You can look at all your blood results. We're completely open about it. A lot of guinea-eyes patients see their blood results before we see them, and we have no problem with that at all. You can also graph them. You can put in ones from your own GP, etc., etc., etc. You can, importantly, you can see your letters. So you can see all the letters we've written about you. Also, if other people have written letters about you. You can keep a biography about yourself. You also can see blood pressure, weight, blood sugars, etc., etc. So this was really just the starting point. This was us saying, this is all the data we've got, and you can have that about yourself. And it does mean I have a number of patients who, for example, if they're on the ward with us, they'll be looking at all this on their iPad, or they go to their GP or their local doctor, and they say, it's okay, I've got all my data with me, and wherever they are, because it's accessible via the internet. It's in theory in line with the government strategy. I'm not sure if that's important or not, but the government want you to be able to access all your records online. But in most places that's not actually possible. But I think it's reasonable to want that. We do monitor it carefully, and we've evaluating what both clinicians and patients think about it, and it's part of a number of grant applications as well. But what's next? And I think probably what's next is hopefully exciting for you guys, and hopefully this is what will break down these geographical barriers I was talking about. So in particular, I'm going to talk about virtual clinics. This is just an example in the West Midlands. We actually get referrals from elsewhere, but how things might occur in the future. And the idea is that you, the patient, should have all sorts of ways to access us, the clinical team. And because at the moment, for a lot of people, it's just that formal clinic appointment, either 6 months or 3 months or a year, and then it's hard to access the team in between. But we'd like you to be able to email us, phone us, come to a formal clinic appointment if that's what you want, or have a virtual clinic appointment. And a virtual clinic appointment, I'll show you, we're pretty close. There have been a lot of barriers to getting this done, but we're pretty close to being able to set this up. And partly that's thanks to the support of PSC support as well. So, how might it look? These are some screenshots of what it's going to look like. So you'd be in your MyHealth, and it'll say your virtual appointment is about to begin. So you could do this wherever you want, whether it's in your office, whether you're at home, you're sitting in the park, wherever you want to have your virtual appointment. You get taken to the virtual clinic page, and you can click attend clinic. It'll be running late as usual, and so it'll say, you know, you're early, and that Dr. Jones is currently seeing someone else, and importantly, we're going to have a virtual waiting room, so you can actually see where you are in the waiting lineup and go and have a cup of coffee, or you can go and watch the cricket or whatever, and then come back and see where you are. So at the moment, I know a lot of our patients will come for the whole day. And in fact, some patients come the night before and stay in glamorous Birmingham just to see us. And when you're then running an hour or hour and a half late, you feel pretty terrible. So this hopefully will revolutionise that for people if they feel that this is okay for them. Of course, this is not going to replace seeing us face to face. Then you'll obviously need to have a webcam on your computer, but you'll speak across something that's pretty much like Skype, and and actually we'll record the audio of this, and you'll be able to play that back. So if the things I can't quite remember what they said, you'll be able to play that back at your leisure. There'll be text chat down the side, so if there's something, a new medicine that we say, we can actually just type that in and you'll be able to see that as well. And then the session will end and we'll produce a letter as before. So that's just about the virtual clinic. We're pretty much going to be the only place in the country trying this, and I think we'll learn a lot by doing it. Probably it'll be the autumn when we start running our first clinics, and the PSC clinics will be the first to up and running. And I'm sure the first ones, there'll be some problems, but hopefully this is something that I think will be popular with patients as another option to the normal clinic. And certainly we've been using patients to design this format. So what about accessing Gideon's trials? How might we help you do that? So again, what we need to know is we need to know people have got PSC or not. And so probably we still need people to come to us once. And he's mentioned our new Institute of Translational Medicine, and I was looking around it the other day. It's going to be a lovely facility and it'll be great for running a number of our clinics through. And you'll come that one time and we can get all your data about you, all your blood tests, and put that into the database. Now, we may be able to manage you a bit more remotely and save you travelling, but what it does mean is we've got your details if any of Gideon's trials become suitable for you. And what we can do, we have a tool that can quickly screen your data and come up with those names, and it'll show whether you'll meet those inclusion criteria, and then Gideon's team can contact you and say, actually you've come up that you might well be suitable for a trial. And then you'll be contacted, you'll get trial information, communication, and hopefully, you know, this obviously will depend certainly, that there will be a degree of virtual follow-up as well, negating all the travel in the future. So again, this is using technology to try and break down those barriers for accessing trials. So what we think is that you guys with PSC should have access to specialist care like at the Queen Elizabeth and in other specialist centres in the UK. And what we hope is that technology will allow you to access that specialist care through using virtual clinics and the virtual access to clinical trials in the future. And we hope all this will start to be available over the next couple of years. So very happy to answer any questions. And lastly, thank you to this is just a thank you to all the various groups that have supported these projects so far. So West Midlands Academic Health Science Network, PSC support,